Hello, everyone. Good afternoon. It is great to see so many of you back joining us today for a special session for parents, partners, loved ones on navigating medical school. We are really thrilled to share with you a very special panel of people who will speak to all of us about the various aspects of what we do in student affairs, in curricular affairs, our infection prevention precautions, how we deal with wellness, so many aspects of medical school that we want to make sure you're familiar with. As you all know, the last 7 or 8 months have been really challenging around the country. I would say in particular in New York, where we were the epicenter for way too long. And we have managed, I think, with great pride to deal with the pandemic on many different levels very successfully, protecting our patients, protecting our students, the staff and faculty at Mount Sinai. We want to talk to you about some of the ways in which we have learned very important lessons and pivoted as a result of the pandemic. And I also want to say that all along we, from the very beginning of this experience, focused ourselves on guiding principles and made sure that every decision we made in the medical school, every decision was made through the lens of those guiding principles. First and foremost in our minds was safety, the safety of our students, the safety of our staff, the safety of our doctors who are practicing clinical medicine, and of course, the safety of our patients. That safety was linked very, very closely to wellness, which we'll talk about a little bit more, is overlapping, I would say, with safety, but a very, very different kind of experience, in particular for students, and the importance of equity, of making sure that students, no matter their background, had a level playing field in which to learn in medical school. After safety, I think what was really important for us was to keep reframing for ourselves and for our students that this was an unprecedented, a historical public health crisis the nation has never seen before. And I think one of the reasons that guiding principle was so important is it allowed us to keep pushing back from what was happening in the moment and realize that it was happening to the entire world, the entire nation, not just to us at Mount Sinai, not just to us as medical students. It was very important as a guiding principle for us to keep our students on track, to not disrupt their education no matter what happened, to not delay anyone's graduation, and we did that very successfully. And then the other guiding principle was the importance of flexibility and technology in allowing our students to be able to work remotely, which for many of them, they currently continue to do today. And so after kind of going over those quick guiding principles, we want to do a little bit of an interactive session with you, the audience, to get a sense of who you are and where you're at. So we're going to use a technology called Slido. There'll be a slide that goes up in a second, and we'll walk you through how to use it if you have not used it before. So if you've got a phone, you can go to slido.com, or you can scan the QR code on the screen. Either way, when you go into the system, it's hashtag 2024, the class of 2024. And if you're doing this on your phone, you'll see that a question comes up. In what state are you currently located? So take your time. This is not a test, so don't feel like you're rushed. And just type in, once you go to slido.com, hashtag 2024, just type in what state you're currently located in. We'd like to see where you're at. Everybody's in Alabama and New York. Okay. All right, here we go. I knew that was going to happen. Pennsylvania, Texas is represented well. Keep it coming. Florida with an exclamation mark, all the way out in Oregon and California, down in Virginia, up in Massachusetts. Just type in the state you're in once you get to the question in Slido. You're doing great so far. We have a nice spread of people from very, very different parts of the country. A couple probably from New Jersey. That's great. Okay, let's move to the next Slido question and get a sense of who you're connected to. Again, slido.com, the questions should come up automatically. If somehow you're taken off, just go back to hashtag 2024. And when you see the question pop up, type in the first name of your student. Oh, there we go. You know exactly how it works now. Caroline, Alexis, Kevin, Remington, nice, nice. it's amazing what a personal connection to the practice of medicine it is to have a kid who's in medical school. I can tell you that one of my boys went to medical school, and Dr. Charney's sons did as well. And it just brings you in a very intimate contact with what it's like to become a doctor and with the practice of medicine, with the practice of science. So we're looking forward to the experience you're going to have with us over the coming years. And then the last question that we have really has to do with yesterday and how it went. And using, again, Slido.com, what emotions or emotion did you feel at yesterday's white coat ceremony? I know how we felt, seeing almost 900 of you logged in, but what emotion did you feel? Lots and lots of pride. It's funny, that's almost the first thing that comes to mind for us as well. Very special, and it was very exciting to see everyone kind of getting hooded by parents, loved ones. There was some crying, I'm sure that there was, very heartwarming. And gratitude, I think gratitude is something that we try to instill over and over again. Grateful and gratitude in ourselves for everything it takes to get one of these very, very special young people to this point in time and to get them through the process of medical school to become just phenomenal doctors, scientists, public health professionals, activists, everything. I just want to see a couple more of these because they're really beautiful. Thrilled for Janet and the class. And yes, they're part of a community now, a new community for all of them. It can be a little bit scary, but also very, very exciting to be starting kind of a new step in their lives. And blessed, yes. And nachas too. Okay, that is great. So I'm gonna thank you very much for interacting with us. Now we feel like we got to know you a little bit better, despite the fact that we're doing this on Zoom in 2 dimensions. And it is my pleasure to introduce to you someone who you met yesterday, Dean Dennis Charney, who's the Ann and Joel Aircrans Dean of the Icahn School of Medicine at Mount Sinai, President for Academic Affairs of the Mount Sinai Health System, my boss, my mentor, Dr. Charney.
Well, thank you. I got to get to know how to use Slido. I hear a lot about it from the students, my son, and just to tell you a little bit about having a son as a med student, which was a great experience for him and for me. And he also gave me a lot of advice about being a dean, which was helpful. And now he's actually on the faculty. So it's my pleasure to welcome you again, our first year students, parents, grandparents, and other family members, and addressing this to the students. And I emphasized this yesterday as well. When you apply to our school, the Icahn School of Medicine at Mount Sinai, we were a very different place. At that time, you knew studying at Mount Sinai you would get the experience that would be very broad, but no one, as Dr. Muller mentioned, knew what was about to hit Mount Sinai, and it was and is a unprecedented personal experience for many of us, and for our institution, and for our city, and for our nation. As has been mentioned, from March through June, we were the epicenter of a global pandemic. Your professors were among the physicians and the nurses, the support staff across our health system, and I can't emphasize this enough, who heroically treated and saved thousands of COVID-19 patients. And at the same time that we were treating those patients, and we didn't have a lot of information at the time in terms of what was the best treatment, at the very same time, our scientists were conducting research into the disease. And their discoveries have dramatically improved our ability, not only at Mount Sinai, but across the nation and the world, to understand this disease and to develop better outcomes. There's no doubt that Mount Sinai scientists, who will be your mentors, saved many lives. Through those difficult days, as Dr. Muller mentioned, and you'll hear more about this, we kept our students on track, continuing their education. In addition, this was a life experience for our students that they will never forget. They played a key role in Mount Sinai's response to the pandemic. They volunteered across the health system. They wanted to be volunteers. They acquired and sterilized our personal protective equipment. They triaged patients who were experiencing COVID-19 symptoms. They supported the Mount Sinai pharmacy, our outpatient practices, our laboratories, hospital operations, and many other things that they played a key role in. Their spirit of being volunteers was exceptional. It made us very proud. This speaks loudly to the talent, the determination, the character, and the camaraderie of students at Mount Sinai. And I definitely know that your class will do the same. It goes without saying that you're bright and that you're creative and you're passionate. More than ever, our world needs students like you to study medicine, to become the next generation of outstanding physicians and researchers who will change the lives of our patients for the better. Our COVID-19 precautions required that you begin your medical education virtually. And I'm pleased, we're all pleased, and we'll talk more about this, that you transition to online learning. I wish I could say that this was the greatest sacrifice you'll have to make in your career. It won't be. It definitely won't be. Medical school requires long hours and very, very hard work. But learning to heal others and becoming a groundbreaking scientist is an exceptional experience. But it must not come at the cost of your own health and well-being. And I can assure you it won't. We will make sure of that. Mount Sinai's Office of Medical Student Affairs and our Office of Well-Being and Resilience will provide you with support and the guidance to help you succeed and maintain your mental and physical health. You will have access to our wellness advisors, who are experienced social workers, faculty advisors, student advisors, career advisors, tutors. They will help you with your study skills and the challenging content that goes along with becoming a physician. We will help you develop resilient strategies that help you cope with the challenges of becoming the best physician and scientist that you can possibly be. I take great pride that there is no better place than Mount Sinai to learn the practice of medicine, engage in biomedical research, and participate, and this is very important, participate as an advocate for social justice and equity in medicine and science. So let's begin. Let's work together to make our world a better and more just place. Thank you very much.
Thank you, Dr. Charney. And now I'm going to jump right into the panelist introductions, and I'm going to ask the permission and indulgence of our panelists to address them by their first names, just because we're all one big happy family and we are welcoming you into our family. So I'll call on you, and as each of you could call in, if you could just take a minute to introduce yourselves and maybe say a couple of words about your role so that we can frame this for today's listeners. So Shashi, do you mind starting?
Sure, I'd be happy to. I'm Shashi Anand. I'm the Associate Dean of Undergraduate Medical Education Affairs, and I am in the curriculum team, and I work with faculty and staff to ensure that the learning environment runs effectively and smoothly.
Tara, do you mind going next?
Hi, everyone. I'm Tara Cunningham, the Senior Associate Dean for Student Affairs. And student affairs for us, many of the things that Dean Charney just mentioned, the wellness, the academic support, being there for students from matriculation through graduation and even after. We're about 1 week away for our senior students to begin their residency application process. And so guiding that work, preparing and supporting along the way to get them into that residency spot of their dreams. So that next journey, it's a true pleasure to be a part of. So thank you for being here, and we look forward to our conversation today.
Thank you. Alicia?
Hello, everyone. My name is Alicia Hurtado, and I am the Associate Dean for Medical Student Wellbeing and Student Affairs. I work very closely with Tara in the Office of Student Affairs. I also work very closely with the Office of Wellbeing and Resilience. I'm also a psychiatrist by training. I went to Mount Sinai Medical School, did my residency, and basically haven't left Mount Sinai. But I use a lot of my mental health expertise to inform how to keep our medical students well. Welcome, everyone.
Thank you. And last but not least, Valerie.
Hi, welcome. So excited to be here with all of you today. I am Valerie Parkas. I am the Senior Associate Dean of Admissions. So I do admissions for the medical school. And I know all of your students quite well from that process, and I'm excited to see them here. I have also been doing over the last 6 or 8 months, and I think the main reason that I'm here today, I'm an infectious disease doctor, and I've been doing infection prevention, educational infection prevention. So in the school, and really collaborating with student health, and also institutional infection prevention. So it's been a journey and something that we've been collaborating with.
Thank you. And thank you all again for sharing your precious time with us. And also, we want to thank the parents who submitted questions. We're going to use a bunch of your questions to kind of guide the conversation. The first question is something that we have all alluded to, I think, in the first few minutes of this session. We've all been through very challenging circumstances in the last half year or more because of the pandemic. And as Dr. Charney said, it is not over. We continue to try to deal as best we can with the circumstances we've been given. If each of the panelists, and I'll call on you in turn, if each of the panelists can talk about one thing that during the course of the pandemic really forced us to pivot differently from what we've been doing in the past, and maybe some ways in which we have learned important lessons because of that pivot. Tara, if you don't mind starting.
Sure, thank you. And again, I hope that through this conversation today, we give a little insight to what your students are experiencing. And to really address that question, I'll say that the last many months for all of us, and this is something that we've shared with our students, to be as vulnerable and transparent with our own feelings through this pandemic experience, is that we've had to really help our students and ourselves manage uncertainty. And that's really tough for students that have been so organized and thoughtful to their career planning steps. And I'm sure many of you on this call may remember the very first time your student said, I want to be a doctor, and how they've stayed steadfast to that goal. And it's tough when your timelines are shifted or those expectations change. And so working with our faculty advisors, those are the 10 physicians that you saw yesterday coding students, and pairing them with a wellness advisor who is a licensed or are licensed social workers. Those two individuals have now created an environment called a learning community for our students. And we're not leaving things to chance. Things that come to mind are resilience training and community building, increasing our self-awareness. Where are we vulnerable in some of our emotional intelligence area, or perhaps areas of personal development? And in these learning communities and through the thoughtful creation and delivery of a wellness curriculum that Alicia has been what we call our student affairs cares approach. So we're no longer leaving things to happen chance. It's often very easy for first-year students to build a community. They move into Aaron Hall and they have suite mates that become really lifelong friends. And how can we negotiate that space in this virtual environment? And probably our biggest lesson learned is we can actually do a lot more than we thought we ever could in a virtual environment. and switching all of our staff, all of our support services, our curricular development and support, our mental health supports, and having those real hard conversations with students. We've not missed a beat. Is it a replacement for face-to-face? Never, I don't think is the case, but it certainly has maintained, and if anything, forced us to be creative in how we manage these services moving forward.
Thank you very much. Alicia, I wonder if you could also speak to, from a mental health and wellness perspective, maybe even in more detail, what shifted for us during the pandemic and what good lessons have we learned from that moving forward?
Yeah, in thinking about this, I think one of the things that has really stood out in my mind is how working together and building that sense of community was incredibly important for us to be able to get by all the really, really tough times. And it really has been wonderful to observe how we've been able to do that. And in one particular area that I've been able to observe that has happened tremendously is how the medical school and the graduate school have been coming together and combining the resources that we have so that we can support one another. I really have enjoyed to see how there have been like new friendships that have formed, individuals exchanging ideas, welcoming one another to different activities. There's this upcoming pumpkin carving event that the graduate students have held in the past. It's called Arts Meet Sciences, and now the medical students are partaking in this. There's another event that's coming up towards the end of the month where the graduate school has invited the medical students to participate in a dessert break. And so we're now thinking about how we're going to be able to get together in a safe way and share in some of these, partaking of some fun. And also, something that happened very early on was this idea that, again, how important it is to have a sense of community and a sense of belonging. And how we are a family here at Mount Sinai. And that also included our staff and the other people that work, not just the faculty members and the medical students, but also our staff. And so a few months into the pandemic, we launched the All In Together campaign, and it brought together medical education staff and students from the medical school and the graduate school, and people who normally don't interact were now working together and interacting. So we got to know each other better and participating again in events that really emphasized well-being and allowed us to get to know each other in a different way. So I would say that it really has been just how important it is to be part of a community.
Thank you very much. And I want to add to that just one small thing, that one of the things that probably I can certainly say I never did as well before as I should is express gratitude, is just say thank you and appreciate people, which I think all of us learned an important lesson about over the course of the pandemic, how much we value each other. And I say that in introduction to hoping that Dr. Parkes, that Valerie will share with us kind of lessons learned, because the role that you spoke about before, Valerie, this infection prevention role, it literally didn't exist. It had to be created from scratch in response to what was going on related to the pandemic. And what good fortune for us to have a couple of leaders in medical education who happen to also be infectious disease experts. So I wonder if you could speak a little bit about lessons learned from that perspective.
Yeah, sure. So thank you. It is interesting when you look back upon sort of the evolution of a team now called Educational Infection Prevention, that it didn't exist before, and how it's become really sort of a one arm of a large collaborative group of leaders in medical education. I sort of go back to my other job in admissions with the sort of first moment, which feels so quaint right now, that we were struggling with to cancel Revisit, which I know that all of your students had canceled for them. And you probably are aware of that because they probably called and said, I was going to go revisit at Mount Sinai at Icahn School of Medicine, and it was canceled. And it felt like this big, huge decision And now as we look back, it is actually it was a small decision in a way, because all it was a recruitment effort. But at the time it felt large. And now all these months later, with such hard things that we've developed and with such hard things that we've gone through, it does feel smaller. So infection prevention, I think we just developed a group of infectious disease doctors and student health. And we've had a bit of a voice in many of the decisions. So as Dr. Charney talked about, we had a volunteer core of students when they were not able to be in the classroom, when we were surging, and they did everything. And we had to make sure that they were doing things from an infection prevention perspective, that they had proper safety measures in the mask and the gowns and the goggles, et cetera, which we call PPE, that we had access to that we were not running low in the school, that we had certain protocols in place for if a student got exposed either socially or in the community or in the clinical arena when they went back to it, that the health core group of students who had graduated early and joined residency early, that they also were supported in that. And now sort of protocols and policies in our housing around the gym, around the visitor policy, and they're not always popular, but they are from a place of public health and from a place of love and safety and, this family unit. So I think we do a lot of our work thinking of getting students through our guiding principles to have their education intact, have their wellness intact, have their safety intact, and graduate doctors who are ready to sort of be the change agents that we need. So that team has been, for me, it's been a privilege and a learning experience, and been hard but collaborative.
Thank you. And Shashi, the curriculum is got a million moving pieces, which we always knew, and I think we learned some things the hard way. Maybe you could talk about one or two things that really pivoted rapidly at the peak of the pandemic, and then maybe some longer term lessons learned from that.
Yeah, I think it's hard for most of us to really imagine that a medical school can go remote, given the tactile need of learning specific clinical skills, the ability to work in teams, which is so critical to your fundamental development as a doctor. And I think that, when given in the moment of having to pivot in March of last year, I think one really big highlight that I can say about our curriculum is that it has been very flexible. We've been able to adjust given the types of methodologies we use, and the flexibility of our faculty, frankly. They have really been creative about shifting things remotely so that students still get that really robust patient experience. It's why they're here, right? And I think this is particularly notable in our Arts and Science of Medicine course, which is our doctoring course. There are certain skills, such as physical exam skills, that really require those tactile activities. But we've been able to teach the kind of knowing how to do it, the steps on how to do it now. And then when we shift to the in-person training, students will be ready to practice right away and really hit the ground. So we've taken some of these kind of flexibility opportunities to shift. I think one critical thing that we learned is that the patient is at the core. So continuing to have those patient presentations virtually was so critical and continues to be critical. And frankly, the patients want to be there. They see the need for it. They're anxious to present in front of medical students because they want to be part of that training given the environment that we're in right now. So all our courses have patient panels that are really designed to kind of understand the perspective of the patient. And that happens from the get-go as soon as students arrive here. And I think another big part of it is this idea, and I think you've heard this from a number of us right now so far, is this idea of community. And that shows up in the curriculum as well, because when you're in ASM, you are part of a community. You're part of a community of students, your preceptor, your social worker, you're part of your learning community. So this is all interconnected, and we designed that specifically so that students feel supported as they move through the curriculum, whether it be remote or in person. And I think some lessons learned, I think we were very fortunate at Sinai that we were ready to hit the ground running with Zoom because the institution had invested in this already well before the pandemic. So we were able to shift quickly with that. I think the lesson, I'm always amazed by our faculty who just are continually creating and shifting to adjust to the learning environment, and listening to the students. I'm always impressed with our students, but I mean, my gosh, the first year medical students, the students who really stepped up this year to represent their classmates, even though it was outside of the, we hadn't done class elections yet. They were like, we need a voice for our students, and really partnered with our faculty. So I think there's been, it's challenging, certainly, but I think it's really, really builds our community as a whole.
Thank you very much for that, Shashi. And I would only add to cap off that question is that at the peak of the pandemic, it was really this team that you're looking at and this Zoom call, plus others, of course, as well, that brought together actually all of the medical schools in New York and New Jersey who were at the epicenter, and hosted a week-long symposium. We called it a Subway Summit. And we wanted to be able to discuss and record for posterity, frankly, for other schools around the country, what it was like to shift medical education in response to a pandemic. And I think that really showed a lot of foresight, because as we've seen over the last several months, the pandemic has surged all over the country, and now pretty much every medical school is having to learn how to deal with it. The second question that I'm going to raise is, again, a question that came up from a number of parents, so it's sort of a consistent theme, and I'll frame it a little bit and then get to the question itself. Medical school is hard. It's really hard. The pandemic has made it even harder. Sadly, the political environment we're in has made life even harder than that, and there are issues that are kind of raging around the country in terms of social and racial inequities. And on top of that, students are also dealing with a level of isolation, whether they're at home learning remotely or they're in Aaron Hall. But still, the need to be socially distant has created a lot of stress. As a parent, as a family member, as a loved one, as a partner, what can I do? This is the question to the panel. What can I do to best support my medical student? What can I be most mindful of? How can I be a positive force in their education? Alicia, I wonder if you would start us off with some thoughts.
Sure. I would say that probably the best way to support your student is really something very simple, which is just to ask them how they're doing, and how you can help them through the medical school process. It is really important to acknowledge that some negative feelings are also okay, that it is okay to feel some anxiety, perhaps some irritability, that, sometimes with all the pressure, it's okay to have some of those feelings. And to talk about it, not from a perspective of blame or but look at what you're doing that's contributing to this, right? Not from a place of blame or judgment, but rather that it's okay to feel these things. And how can you help relieve some of the stress that they may be experiencing? Is there anything that you can take off their plate? Something that we observe as faculty members working with medical students is that sometimes because they're such capable people, it is really natural for people to gravitate towards them, to turn to them for help. And so this is the time, where it's going to be really important to recognize that given all the responsibilities that your medical student now is facing, that maybe it's okay to minimize some of their responsibilities in other parts of their lives. And that, when things get a little quieter or they're on a break, that perhaps they can become, again, more involved in other expectations, family expectations, but that right now, capable people also sometimes need some support and help.
Thank you very much, Alicia. Val, I wonder if you could add some of your own thoughts and wisdom.
Sure. I think I'm going to echo a little bit of what Alicia said. I think that med school is hard. And I think all transitions in education and professional institutions is hard, right? Every time that you go to a new thing, it's hard. And so I think allowing them to sort of have some time to adjust, to get their academic legs under them, figure out how to do this med school thing, build some community, figure out who their team is, and their team is going to include you, but it's also going to include their peers and their advisors and those of us here. It might include a research mentor. It might include, their friends from their previous years, but they need a team of folks because it is academically hard, it is emotionally hard, and it's a lot of work. So I think sort of understanding that and being part of their support system is just critically important. And I think that all of us on this phone call also, or on this Zoom, want to be part of that team as well. And so we believe deeply that they're entering and have entered a family here. And they're going to do amazing things in science, in scholarship, in medicine, in advocacy. And I think we'll all be proud, the big words that you used on the Slido, watching them do it.
Thank you. Shashi, you've been with medical education now for a while, for a long time, and came to medical education from a little bit of a different culture too, and you've bridged kind of curricular and student affairs. I wonder if you could share your perspective on as a loved one, a family member, a parent, a partner, how can I best support the medical student I love the most in the whole class?
Thank you, David. I think that one thought that comes to my mind is this idea, especially for the parents who are not physicians or who don't know the world of medical education and all the milestones, that it's okay to kind of check in with your student, to know that their workload is very heavy. And I think this is a great point that Dr. Park has brought up, is that it is academically challenging. And I think the one thing that I always tell students when I see them struggling is that it's okay to ask for help. And I think the biggest thing that or one of the many things that you can do in that support place is not necessarily know all the ins and outs of medical school, but to reinforce that it's okay for your child, loved, family member, whatever, to reach out for help. And we have a number of resources at Sinai that are dedicated to medical students and are ready and waiting and want to be there. And that's what we're here for, is to help. So I think that would be my advice to you, is to normalize that it's okay to reach out for help, because I think many of the students who come in here are incredibly driven, or all the students are incredibly driven and dedicated, and might forget that part, or might not know how to navigate the system. So I think that's an important thing, and I think Tara will probably talk a bit about that too, so I don't want to steal her thunder. But I think making sure the student knows how to navigate the system is important.
Thank you, Shashi. And Tara, and even though you, I think you just passed your 1-year anniversary with us as a senior associate dean for student affairs. So in some ways, you're the newest member of the team, and yet you come to us with kind of a lifelong, outstanding reputation and expertise in higher ed, and have really brought just enormous wealth and resources to the work that you do. I wonder if you could share some of your perspective, having seen what you've experienced over the years, and also in the last year that you've been with us here at Sinai.
Now, whoever would have thought that the first year would have been during this time frame. And so for those in Arizona and Texas, I said my greetings. Those are my former professional homes. And this time of the year, I miss those environments. I think before maybe I address other ways that we can support our students, I think it's really important to share my daughter who's a college student in another state and really struggling through not to the academic rigor, but the social isolation and some things. And she'll call, and I put on my student affairs hat, and I'm often reminded that she just needs mom to listen. And it's okay that I don't have a solution for her, but it's just having that listening ear where the judgment, where in my eyes, she's the most outstanding person in the universe in that moment, and just to reinforce and just be there as a supporting ear. So none of that, it adds expense to our day. It's just really important that we listen without the expectation of the student doing anything with, if we do have advice to give, but just to be there. I think everything that's already been discussed are absolutely the really critical moments for our students and how families can support. And medicine is a little different because at this point in a student's educational career, we really do see them to be adult learners. They are physicians in training. And so the relationship between parents and the medical school may feel very different to you than your interactions in the college setting or in those university settings. And while we have to respect those boundaries, and there are reasons that we have, that responsibility on the students, they have to practice this self-awareness and self-responsibility, it doesn't mean that there's not a way to partner with our families. And you may see something early on that's a concern to you. You may see a change in behavior. You might recognize a physical appearance change for good or for worse. And sometimes that may be the last little bit of information that's really helpful for my office, for my staff and other teammates to put together kind of a complete picture that this might be a student in distress. And this is where it's been very difficult to do virtually. We have literally not been able to put a physical kind of eye on our students for so many months. And so it does require that if you feel something, if you hear something, your student may say something that is of concern to you, please always feel very comfortable to reach out to me, to David, to others on this call today, and we take care of that information. It's treated confidentially, it's not broadcasted, and again, it's safely managed within the respect of our policies and what we can then share back. So we certainly don't have parents calling and asking about grades, and that's a really great thing. There are protections for your students' educational data and performance, but I think some of those, again, non-academic concerns, we may, often just kind of brush to the side of being a bad day, and it might be, and but to really encourage your student to also be the one to reach out to our mental health support team. We have a wonderful service of student training in mental health that provides great care to our students at no cost. And those are unlimited visits. And it's comforting to have that particular service provided to medical students. And it's very accessible even in these moments for some of our students at a distance where we have other things in place to support them. So all that to say, if you ever feel that just something is amiss, never hesitate to reach out and to encourage your student to also reach out and ask for help, even when it feels pretty scary to them. So to encourage and support them through that moment.
Thank you, Tara. And so I want to pivot to the next question and really frame it around the theme of uncertainty. There's just been enormous uncertainty in the country, in the world, since the pandemic began. We still don't know, we meaning all of us don't know how much longer this is going to take. When is a vaccine going to be available? What do the numbers look like in New York or Wisconsin or Arizona or Texas, anywhere around the country? What direction is it headed? We know that in our health system and in our city, the numbers are tracked on a very, very granular level. And our intention always, meaning the whole health system, is to be proactive, not reactive to those numbers. And so at the same time, we have been pushing really hard to put together a solid plan for getting all of the first-year class onto campus over the course of the next couple of months. And probably you know that already. We sent a communication out related to the staggered entry that we're planning to put in place for students to be on campus and, if need be, travel over the holidays and be prepared for spring semester. So the beginning of our spring semester is going to be remote the first 2 weeks, because as people come back from winter break, we're going to want them to have a buffer of time where they can still quarantine if necessary. And then the rest of spring semester, our plan right now, and I say right now because we always qualify these statements, our plan right now is for the rest of spring semester to be hybrid. And so with that, I want to go to the question about learning and hands-on learning, and maybe ask Shashi to talk a little bit about what that might look like in spring semester for the first year class. What might hands-on learning look like? And after that, since we can go from one speaker to the next, go to Valerie and talk a little bit about what it's like to keep students safe in a clinical environment. And again, I don't want to frame too many questions at once, but there are two pieces, I think, to that parents want to hear about. One is, what do we do to make sure that students are safe from COVID in a clinical environment? And what does that look like in the context of congregate housing? Because I think it's impossible to answer those questions without linking them together. So maybe Shashi, you could go first and talk about the hands-on learning that we want to be able to provide, and then we'll go to Valerie. Thank you.
Yeah, absolutely. So there's two types of sessions that we're planning to be in person. Those are our Arts and Science of Medicine small group sessions. That's our doctoring course, and then our labs. So I'll start with ASM because I mentioned this a little bit earlier in the conversation around this idea of physical exam skills and how there is a really stepwise process to that. I also mentioned that they're learning the kind of knowing how to do things right now, what the different steps are. So when they return in the spring, the goal is then they actually apply those skills in a hands-on way, actually demonstrating them. And I don't want to get too much into the IP part because Val's going to address that. It does kind of cross over and overlap. We are very integrated in how we're approaching our educational activities. But suffice to say that the goal is in a safe way, social distanced, appropriate protection, etc. So in the sense that with our clinical skills, it is very progressive. So they need to kind of know those skills. I mentioned the flexibility of the curriculum, so we've adjusted for that. So that hands-on experience for those critical skills will be in person starting mid-January. And then we have our labs. There are definitely labs where someone needs to see the heart. They need to be able to actually see it. We've done a lot of creative things this semester, utilizing various technologies to see and scan into various lab specimens. And now we want to take it to the next level where we'll have rotating students shifting through the classroom and being able to experience that and visualize it and have that tactile experience that it's hard to do in a remote environment. That's what we'll be doing starting in January.
Thank you. Valerie?
Okay, so how we're keeping their students safe in 2 minutes. No, I'm just kidding. The clinical environment, safety is our number one priority, and learning clinical medicine is our number one priority. So balancing those two is critically important. And we pulled the clinical students from the clinical environment when we didn't have when the cases were surging, when we were sort of in an unknown moment, and when we didn't have the right proper PPE at the time for everyone. We needed it for the people taking, the doctors taking care and nurses and team taking care of the patients. And then we have the students back in since about late June, because now we have figured some stuff out. We have proper PPE, and they need to learn, and they're entering a profession. There has been, the data shows that folks with proper PPE in the clinical environment are quite safe as long as they're taking the proper precautions, and that has been our experience here. And we are very, very intentional about all of our clinical arenas, and some of our hospitals, as you know, might have slightly different rules and regulations, and so we are invested in knowing everything that's happening at each clinical arena. Now what happens socially, right, outside of the clinical arena or the lab arena, is that our students are in our housing, which we hope that you will have the occasion of seeing sometime in the future, because it's actually quite lovely and nice. And we've managed that quite intentionally as well. There was a question in the chat, I think from Janet's father, about housing. We have both couples family housing, and we have Aaron Hall, which is sort of a hybrid between dorm and apartments. And we are rather intentional about making sure that folks are safe, having rules about public spaces in housing, as well as in the hospital and in the clinical arena and the classroom arena. And making sure that people are abiding by those rules. We have done we have put a lot of procedures and protocols in place around testing. We have excellent tests here at Sinai. The scientists have been unbelievable here. We know from our data that approximately 10% of our students have an antibody, and that's data going back about a month or two, so it might be more now. We know from we know that what we have been doing has been quite proactive. So the following students are tested, right? Students who are symptomatic and they have to fill out a tracker every single day. Students who have traveled from a high-risk area. Students who have had a contact. And students who are incoming into our housing. And that has been evolving, but by being really, really specific around testing those folks, we've been able to catch incidents of infection, and then we have very, very well thought out guidelines around quarantine and isolation. Isolation being folks who are positive, and quarantine being folks that have been exposed. And so we have been, on it every day with a large team and a large travel registry. And it has been it's been working quite well. Now, as Dr. Muller said, in introducing this area of discussion, there's uncertainty. And there are different things that we have to evolve and pivot to and be nimble about. There were times during this pandemic where community spread locally was higher than community spread elsewhere. Currently, elsewhere, there's higher numbers, and so we have discouraged travel. We have been intentional about students coming in from spaces or spots that are considered hot spots. And we will continue to sort of be able to pivot within that. And our intentions are safety, public health, patient safety, student safety, and educational progression. So with all that, I hope I answered all the questions.
Thank you. That was very comprehensive. There's a question that comes up that is really closely related to that. And it really has to do with what happens when a student is COVID positive. And it happens, I think I can share even just for a minute my own experience. I don't have any children in medical school now, but we've been living with a couple of our boys at home, and one of them a week ago Saturday developed symptoms that seemed to be a little bit more than his usual allergy symptoms. We slapped a mask on him right away and socially isolated him as best we could. And 24 hours later, he wasn't better, so he got tested and he was positive. The relevance for this conversation for me is to go through the process of our attestation. So as employees in the institution, I attested right away on the app that Sinai has that I was exposed to someone. I went right away and easily got an appointment to get tested myself and tested negative. And literally the next day got called by the employee health service to track me, to make sure that I was remaining asymptomatic, to make sure I knew how long my quarantine was. So I bring that up only because the system is really, really tight, and it's a system that is serving more than 40,000 people. But again, I want to come back to this specific question, and maybe since Valerie most recently answered, first start with Tara. So if a student is COVID positive, how are we supporting them academically to make sure that they continue on their trajectory? And then maybe from Valerie, how we're supporting them medically as well. And I think we all appreciate that COVID positive can mean a lot of things. I'm going to say, for the sake of this conversation, we're not talking, God forbid, about a student who is really sick and hospitalized, but a student who's tested positive and is symptomatic and is not able to engage. How are we supporting that student? So Tara, maybe please first, and then Valerie, and if anyone else wants to chime in after that, feel free.
Yeah, for sure. And it's a tough, and we all kind of have, we wait with bated breath to hear those outcomes when we do have a potential contact with somebody. I'll say academically, it's so unique by class. And so first year students experience very different than a fourth year student experience. And one sometimes provides a bit more flexibility and forgiveness for absence. And sometimes the other class it switches week to week, depending if it's an exam week or whatnot. For students in the first year class, remote learners, this is where, this has been one of the benefits of remote learning, because so long as a student is feeling well enough to participate, they are able to participate in live sessions that are live, or if it's asynchronous learning or something that they can do at a time different than maybe their peers, they're not missing a step. And we've remained committed. As we started this whole experience, there were several guiding kind of guidelines or guiding principles, and maintaining academic progression is one of those. For students that are ill, and we do have appropriate quarters for them to be safe and to be housed in that moment. The infectious prevention team, student health, coordinates with my office. We coordinate with the academic teams quickly and privately to make sure that the student's schedule can accommodate whatever absence may be. And those are rendered as excused absences. And again, creativity to find opportunity to make up missed work or remediate missed work, depending on the situation. We support students through some food assistance. Back in March and April and into May, we were making deliveries to the dorms on a regular, or to Aaron Hall on a regulated schedule. We've now been able to move into a more electronic gift card perspective for students, so that they can access fresh goods and have meals delivered. For some students that have moved into Aaron Hall for the very first time that have had to be quarantined, they received care packages. Others received dinner and a movie on us to be done in their respective rooms. And so that comfort care, and again, reaching out through our learning communities and our faculty and wellness advisors just to check in with the students to make sure that they feel supported in that moment. Very small things go a long way when you are experiencing a particular concern or scare, and certainly they are doing their best to minimize impact on their colleagues, because again, the academic schedule at some times can forgive, and then there are certain times of the year where we are up against a graduation deadline and we have core requirements that we have to provide our students. And then maybe the easiest or a quick way to answer long-term needs and bigger challenges for classes, that we've had to modify our own educational expectations of our students. Really big exams are now positioned at a time in a student's career where there's less concern if they are sick, or if test sites have to shut down, for example, that administer board exams. Reducing elective requirements so that, again, our students can graduate and become the physicians that we need in our communities. And so from a very small scale of comfort packages to a very large scale of having to adjust academic expectations and everything in between is exactly what we've been doing for these last 7+ months, and probably will need to be doing for the next couple of years as classes promote and graduate.
Thank you. Valerie, can you speak to kind of the arc of what happens if a student tests positive and how we take care of them from a medical perspective, an IP perspective?
Yeah. So one of the central people on the infection prevention educational team is Lori Zabar, who is the director of student health. So we have partnered with her, more than daily, multiple times a day. So I think if someone is tested for all of the reasons that I outlined before, they get that result back within the day. And so they're told to quarantine while they're in their, wherever they live, while they're waiting for that test. And if that test becomes positive, we've set up a system that includes, the student resource team and student affairs and the IP folks and housing, and they are then isolated at a temporary housing place that we've set up. And they will stay there for the 10 days after the positive test, and they have to be asymptomatic for 3 days. So that's been, it luckily has not happened that many times. And we're, just continuing to be vigilant. We have to be very aware of folks who were in contact with them. So we have very, very excellent contact tracing in place, and we're working with the institution on that. The institution has done that very well. And so it will have often impact on the other students who they have either socialized with or live with.
Thank you. Perfectly timed because we have about 90 seconds left. So I just want to touch on one theme that has come up over and over again, and that is that every single one of us has had to make enormous sacrifices this past year, enormous sacrifices. Those sacrifices are going to continue, and there may be some coming that we haven't really even anticipated yet. And what we keep reminding ourselves and reminding our students is that these sacrifices are because of a public health emergency. We hope never to see anything like this happen again in the history of this country. But this is not about medical school, although it touches on medical school. This is not about congregate housing. It is about the fact that every single citizen in this country is struggling with this public health emergency, and we will do everything we can with your help as a team, as a family, to get each other through all of this together. So with that, I want to thank everyone for coming. We want to be respectful of everyone's time and finish at 3 o'clock. Thank you to the alumni community. Thank you to the Parents Council, who are always supportive of our students and the work that we do. The Office of Alumni Relations and Development is always a resource to parents. If you want to reach out, if you have questions, if you want more communication, obviously you can reach out to any of us. We are very, very grateful for all the work they do in raising money for things like scholarships, and leisure space and all the things that they do. We've got wonderful donors. There's been a huge outpouring of support from our trustees. There are parents who've been involved in philanthropy as well. So we really want to acknowledge the work of Anastasia Hagan and Jason Soto and all of their team members in helping us do all the wonderful work that we do. Thank you very much. And we look forward to spending the next many years with you together. Have a great day, everyone.